Now, Guinea health officials have confirmed West Africa's first case of Marburg, a highly infectious disease in the same family as the virus that causes Ebola. The World Health Organization said the virus needed to be stopped in its tracks. Marburg virus disease is transmitted to people from fruit bats and spreads between humans through the transmission of bodily fluids. Cases are extremely rare, with the last major outbreak in Angola in 2005. It is a severe, often fatal illness with symptoms including headache, fever, muscle pains, vomiting, blood, and bleeding. No treatment yet exists for Marburg, but doctors say drinking plenty of water and treating specific symptoms improves a patient's chances of survival. Now to have a conversation regarding what's known about Marburg virus and what knowledge that must be publicly shared about it. As a preventative measure, we're now being joined by Professor John Nwagwu, a United States-based epidemiologist. Welcome. Good to have you join us.
Thank you, Ekene. I appreciate your invitation.
I'm glad you were able to honor it. Now, some would say this is the wrong time to be discovering a fatal disease such as Marburg. I think it has a fatality rate of up to 50%. What is to be done at this acute stage where we're being told by the WHO that the virus needs to be stopped in its tracks?
I think what we need to do is early detection and being able to have a quick and fast diagnosis, because being aware of the cases is number one need to be able to control the disease.
All right, Prof, I want to find out from you. Let's talk about transmission. How is it transmitted from one host to the other?
Thank you, Aaron. The transmission is primarily through bodily fluid contact. If somebody, for example, touches any article that someone who was infected had also touched, or through bodily fluid or blood, sweat, etc. And that's the primarily means of contact for the infection.
Okay, I don't mean to seem like I'm stirring the hornet's nest, but should we be concerned because we found out that this disease is named after a place in Germany, the lab, where it was the first outbreak occurred? Should we be concerned about lab experiments since we seem to have issues around laboratory experiments and virus outbreaks?
Indeed, we should. You are right. The first time Marburg virus occurred was in Marburg, Germany, in a pharmaceutical laboratory. And the contact was primarily through monkeys that was purchased from Democratic Republic of Congo. And the fatality was quite high at that time. So, and that was in the summer of 1967. Indeed, we need to be very careful in our laboratories because we do perform some of those types of investigations in our laboratory. Also with humans, I mean, one way to detect the occurrence of it is through clinical laboratories. And so in some cases, without having the normal hygienic practices and professional practices within the lab workers are also very highly at risk for this disease.
All right, Dr. Nwagwu, please paint us a picture right now. How fatal is this particular virus? Put it side by side with maybe an Ebola, probably hepatitis, probably even COVID-19, or maybe even HIV. Put it side by side. Just paint a fatality picture for us right now.
Yes, Aaron. I think the fatality of Marburg is similar to that of Ebola. I think it's even more so rapid in its fatality. Ebola is within 7 to 10 days in terms of the incubation period before one dies from it. But Marburg is 7 days, so it's a bit earlier in comparison to Ebola. But the fatality seems pretty similar, which makes sense because Marburg is also a close relative of Ebola. They come from the same family of viruses, which are referred to as little beasties.
Okay, what level of high alert should we be stirring up at this point? Because Guinea, West Africa, we're neighbors. So what should we be saying? Because we know even with the history of Ebola and how we managed to escape in this country, some would call it a miracle. In the midst of all that the world is dealing with to do with the pandemic, what additional precautions should we be taking? Is it possible that the virus could cross over from Guinea to Nigeria? What's the rate of probability?
Thank you, Ekene. Certainly, we should not be complacent. That's really the key. And on the other hand, we should not panic. However, we need to be proactive. And I recall telling Dr. Chukwu during the Ebola, I worked with him during the Ebola, I told him exactly the same thing, that we simply need to do our jobs. I think we need to educate healthcare workers who will be the first people to see these cases. So we need to alert communities to be aware of it. In that way, the reporting system will be operational. It is a difficult illness to diagnose because the symptoms are similar to many other diseases that plague us in Africa. And as a result, it could be misdiagnosed, for example, for malaria or for some other disease of Ebola, et cetera, but I think the important thing is for us not to panic, but to be proactive. I believe Nigeria is equal to the task if we do what we know responsibly we should do.
All right, Professor Nwagwu, give us some preventive and protective measures we should take, because just behind you, I can see that you are COVID-19 compliant. You've got sanitizers behind you and hand wipes. But talk to us for Marburg. What do we need to do to stay safe?
The disease control strategy for Marburg are basically threefold. One is health promotion, two is disease prevention, and then three, of course, is the therapy, treatment. At this point, we can only try to treat the symptoms because there is no known and authorized medication or treatment for Marburg. And in terms of disease prevention, we do not have a vaccine for Marburg. So we are left with primarily health promotion, which is basically to educate the people to know what not to do and what to do. And those include basic hygienic practices, for example, washing your hands as often as you could, using about 60% alcohol wipes also. And if you wash your hand, use soap that will foam very well. Make sure you scrub in between your fingers. And in Nigeria, primarily in Africa, we do sweat a lot. And so it would be good, important for individuals to avoid being in a very large crowds where you would expose yourself to exchange of bodily fluid. But I think, and for the clinicians, they know what to do, basic precautionary measures of making sure that they gown well, protect exposure to bodily fluid by gloves, etc., etc. And in the laboratories, it will be similar to make sure also that they follow the universal precautionary measures essential. I don't think we should be alarmed, but I think we should be proactive.
Okay, I know. From what you're saying, if I'm correct, if people were to adhere to the COVID protocols, they would essentially be safe from Marburg as well. Is that correct?
Correct.
Okay.
Okay. Yes.
But just to ask, you say Nigeria is equal to the task. Some might say, is your confidence misplaced? Because what's your assessment of how Nigeria and Africa have handled the COVID-19 pandemic thus far with regards to waiting for donations of vaccines? Briefly.
You could be right, Ekene. And I said we are equal to the task based on my experience with Dr. Chukwu, who was the Minister of Health during the Ebola. I worked with him at that time because I was in Guinea, Sierra Leone, and Liberia under the World Health Organization, leading a team for disease control, the Ebola control. And so I recall working with him, and with what I knew at that time with the Nigerian healthcare providers, et cetera, I was impressed with what we have. I don't know if it's any different now, but I think if we do our job well, we should be fine.
I want to say many thanks to you, Professor John Nwagwu, for enlightening us today on the Marburg virus. So thank you for joining us here on Newsday.